here. And thank you so much for joining us for our big celebration. So let me start by telling you a bit about who we are and how we got here and why we're having this awards ceremony. We all remember the pandemic hitting us last year and the world stopped and plenty of us asked, how did this happen? Why did we get here? What do we do now? And in response to all of that and the chitter chatter and the angst, I resolved with a number of friends that we should take some action and not just talk about it. And we brought together a coalition of 42 like-minded institutions, which we called the Trinity Challenge. Welcome to the Trinity Challenge. We realized that we needed to be able to identify, respond, and recover effectively from the next pandemic. Indeed, can we learn things about future pandemics that would help us now? We knew that modern analytics and data were needed alongside data sets that were not held by health systems or governments, often behavioral. We knew there were talented and innovative people out there, everywhere, working tirelessly to improve health conditions in their communities across every region of the world. We knew that there are people using data and analytics in really creative ways out there. What if these ideas could be brought to scale to benefit the wider world, all the population across the world? How could we engineer a collision between modern data science and public health? And how can we achieve profound shifts in public health? We saw three big constraining issues. Clearly, funding, but also mentoring and making people aware of the solutions that exist and need to be scaled. And we designed the challenge to solve these. So it's a kind of Dragon's Den or Shark Tank sort of thing for data science and public health. And we set up our inaugural Trinity Challenge. First, these awards were created to provide funding to trailblazers, to further develop or indeed fully develop their ideas and help them launch into the wider world over the next 3 years as global goods. Our Trinity Challenge was open to anyone, anywhere. Fantastically, news of the challenge generated an extraordinary response, and we received 340 applications from 61 countries. Secondly, good ideas need to be nurtured and guided to come to fruition, and small-scale solutions need to be mentored to achieve greater impact. The Trinity Challenge is making all of this possible by connecting small teams and the world's largest businesses, academic institutions, and charitable organizations, as well as creating a network for scaling. Our Trinity Challenge winners show us how they creatively use data and analytics to address the toughest questions raised by the pandemic, and in doing so, helping to improve the global data ecosystem with trusted, transparent, inclusive data tools that can achieve long-term health benefits and economic benefits. Of the 340 applicants, our independent panel of judges shortlisted as finalists 16 teams, and then further narrowed the field down to just 1 grand winner, 2 second prize winners, and 5 in third place as winners. It was a task I don't envy. The winners are being recognized as serious trailblazers. Each of these 8 winners are receiving an award from our pledged prize fund of £5.7 million. This, the Trinity Challenge has from our members. Thank you. In addition to the funding, our Trinity Challenge members will also be supporting winners over the course of the next 3 years to help them in their journey to bring their ideas to scale. These networking opportunities will be vital to connect the winners to end users. Of course, you're all keen to hear about the winning solutions, and we will soon. And then you'll have a chance to engage with the teams during breakout sessions, at the end of which there'll be an opportunity networking with the winners and Trinity Challenge members. At this point, I'd very much like to take a moment to welcome and introduce each of our speakers today. Firstly, our two great judging co-chairs who worked with an impressive set of 20 expert judges from various fields. Mark Dybel, who's Professor of Medicine at Georgetown University Medical Center and co-director of the Center for Global Health Practice and Impact, and Tsitsi Masiwa, who's the founder and co-chair of High Life Foundation. Now, too, is the moment to thank Tsitsi and Mark for their support, their hard work, and it really was hard, and expert chairing of the judging panel. They were tough decisions to take. I also want to thank our very distinguished panel of judges from all around the world. This exceptional group of leaders reviewed all the eligible applications. Thank you to all of you. In addition, today I'm joined by Steve Davis, a trustee of the Trinity Challenge, co-chair of the World Health Organization's Digital Health Technical Advisory Group, and former chief exec of PATH. I want to thank you too, Steve, and our other trustees for your guidance and hard work. And you're also going to meet Hala Audi, chief exec of the Trinity Challenge, who kindly dropped other things to steer the challenge over this crucial 6 months. Thank you, Hala, and thank you to all of our team who've done such a great job. Finally, none of us would be here without the brainstorming and support from Hemant, Lars and Vilars. My personal thanks to you too. And now, the moment you've all been waiting for, an introduction to our finalists. So let me start with the finalists under the identity category. After all, surely we should have been able to see a big pandemic coming. We should have had early warning systems in place to say, hey, something's not right here. We all agree the world acted too late. The WHO has said this. So our finalists in this category have come up with some really good ideas on how to raise alerts before zoonotic diseases cross over into humans. Some finalists also look at aspects such as sewage, ecological and behavioral data. And we have solutions involving farmers, livestock managers and community health workers. To put it bluntly, our frontline smoke detectors. Let's take a look.
Sawadee from Thailand and Patipat from PODD. We are combating the spread of zoonotic diseases by turning farmers into disease detectives. PODD does this in 3 ways. First, it provides disease surveillance for local governments. Second, it's an app for farmers to take pictures of sick livestock. And third, it's an early warning and response system for animal outbreaks. But the real reason why PODD works is because people can protect their own livelihood and prevent pandemics at the same time. Since 2014, we have deployed PODD in 31 cities across Thailand and trained over 20,000 disease detectives. Now we are creating the toolkit to scale a platform to the world. You cannot train every farmer to be an epidemiologist, but you can teach them to be the frontline, eyes and ears of the One Health system. With PODD, we can stop the next pandemic before it starts. Thank you and ขอบคุณครับ
Mosquitoes are responsible for around 750 million infections, causing over 1 million deaths from diseases like malaria and costing around $100 billion per year. Ganesh got infected with dengue. It pushed his family into poverty and disrupted his education. Current vector and disease surveillance methods are labor-intensive, not real-time, and very costly. The use of scientific data in decision-making and sharing of the data is lacking. This can be automated, and this is what we did. Our goal is to prevent the disease rather than on treating the disease. A network of smart mosquito traps are deployed across the communities. Our disruptive and unique solution uses sensors, AI, that analyze the data to provide real-time vector surveillance and predict disease outbreaks before human infections occur. Muskit's platform helps to save lives by lowering disease burden, reducing the cost of control operations, reducing pesticide use by allowing users to make data-driven targeted actions. Together, this results in overall higher quality of life. Thank you.
Our strategy is to identify the first case of an emerging disease before it has a chance to become a pandemic. How can we do this? EcoHealth Alliance has pioneered the use of hotspot risk mapping for emerging diseases, but these maps need to be smarter. We're going to automate them using data directly from the web. We're going to use word search matches that tell us real diseases from rumors of diseases. We're going to use machine learning algorithms that produce the very latest information as maps and models so we can work on that and prevent diseases. We're then going to get on the ground in China and Southeast Asia and test this system out with animal surveillance from our own field teams, with human surveillance from Hong Kong University, and with mobile phone data from Tencent. If we can predict in exquisite detail where humans, wildlife, and livestock connect to each other on the planet, then we stand a chance at disrupting the next pandemic.
Hi, I'm Professor Kate Jones at University College London, and I'm really excited to present my team's submission to the Trinity Challenge, the Sentinel forecasting system. So my team is solving the problem of how we can predict and manage the risk of animal diseases jumping into humans. And as we've seen it in the current pandemic, these diseases really have severe global economic and health consequences. So unfortunately, spillovers still take us by surprise, and that's largely because of a failure to understand that the root cause of spillovers is how we treat the environment. So here, my team is going to change all that by uniting data from ecology and social science with cutting-edge genomics and epidemiology to co-develop with stakeholders on the ground a real-time forecasting system for public health agencies in West Africa, starting with a disease called Lassa fever. I hope you're as excited about our proposal as we are. Thanks very much.
My name's Asif Kasim, the founder of MedShare, a medical knowledge platform that connects doctors through case discussion with 1.5 million members globally in 195 countries. We've taken the data from all our cases, discussions, comments, and polls, and using medical natural language processing, machine learning, and artificial intelligence, develop MedShare Insights that allows us to analyze healthcare terms across the global platform. We aim to use this Insights platform together with additional sources of data to develop an early warning system to identify novel diseases and infectious disease outbreaks. Some of the prototyping from our Insights here shows how we can look at the emerging trends here for COVID-19 that include things like vaccine and dexamethasone. The MedShare early warning system is going to be a not-for-profit service that allows us to give additional information to governments, NGOs, and public healthcare and providers to intervene early and prevent future pandemics.
Imagine if you could have detected the presence of COVID-19 before it caused worldwide outbreaks. That's an economic burden. My name is Sherry Katsuyuin, and I lead a team of experts that develop a wireless sensor network for disease surveillance. The sensors detect pathogens in air and sewage even before cases present in populations. They have high specificity and sensitivity for SARS-CoV-2 detection and are easily adaptable for other pathogens. Continuous and real-time data streaming, analysis, and visualization allow community health officials to make critical life-saving decisions. Our team can bring the solution to your communities. We have industry partners who will assist us in all aspects of this project. We are supported by our 3 institutions, the University of Massachusetts Lowell, Northeastern University, and the University of the Philippines. Thank you.
Now, COVID-19 has shown us that pandemic response requires early warnings that happen soon after the first human-to-human transmission. Meanwhile, 4 billion people on the planet also lack access to reliable diagnostics for routine things like malaria, dengue, chikungunya, diabetes, and hypertension. And our plan is to combine the remote diagnostics data from HealthCube, a startup that works on diagnostic platforms, with disease research data from CDEP, a globally renowned research organization working on infectious diseases. We'll combine this with the ecological data and also with behavioral data to build a global platform for disease intelligence. HealthCube is already the most widely deployed primary care diagnostic platform in India. We're used in Africa as well in more than 8 countries. And what we plan to do with the Challenge Award is to expand to more geographies, scale deployment, integrate data from HealthCube and other data sources, and build a global platform for real-time information and intelligence. And these are our combined teams, and we look forward to working with the Trinity Challenge.
Imagine a world in which we could rapidly detect and contain public health emergencies like COVID-19 without any prior knowledge of the underlying virus. I'm here to tell you that this is possible using data that is already available to us. The complete blood count is the world's most common medical test. 3.6 billion are performed each year, and they are an essential part of decision-making in both community and hospital medicine. During the test, a sample of blood is taken and a laser is used to measure hundreds of characteristics about the cells it contains. In current medical practice, only a limited number of these measurements are considered, and the rich laser measurement is thrown away. The blood counts team have developed AI-based methods which use this discarded data to detect disease outbreaks without any prior knowledge of the pathogen. In simple terms, we could have given an earlier warning of the outbreak in Wuhan using data that was already available at the time.
What an amazing set of ideas in order to identify an outbreak or a pandemic. But as we've seen over the last year, we also have to figure out how to respond and respond quickly. We've heard over the last year so many people convinced they could have done a better job in responding to the pandemic. Though the finalists in this category have developed tools that will enable health agencies to synthesize data quickly and focus resources on hotspots and areas of the greatest needs. Now, these solutions could be game changers, particularly for low and middle income country settings. Here's what they have to offer.
The next pandemic is coming, and if you want to beat it, you need an early warning system to track pathogen variants wherever and whenever they appear. I am Madhu Marathe, and I represent the BioGem team, a diverse group of scientists from around the world dedicated to advancing the field of computational epidemiology. We study vexing and timely questions such as, can we detect new pathogens as they emerge and anticipate how best to deal with them? When and how should we sample the environment or other species? Our solution consists of 3 components combined into a globally scalable platform. AI-driven simulations to model co-evolving disease transmission, collective behavior, and viral evolution, moving beyond phylogenetics to characterize relationships among pathogens, and rigorous methods to optimize surveillance systems. The team is singularly focused on developing solutions that have global social, economic, and health impact and realize a vision of real-time epidemic science.
Private companies collect data about human behaviors and mobility patterns from mobile phones at enormous scale. This data has the potential to transform our public health response to epidemics by giving policymakers real-time information about the populations they're trying to help. Data alone aren't enough. You need robust analytical pipelines and skilled people to make sense of the data, with policies changing rapidly over time. Crisis Ready is a platform for developing and scaling the data pipelines and analytical tools needed to translate this complex data into meaningful insights. We're a global network of researchers who collaborated during the pandemic with policymakers and response agencies around the world. We helped them understand where lockdowns were working, how to target surveillance or allocate resources. The data exists now, and the need for data-driven policies is clear. What we will build are robust adaptive pipelines and networks for translating this data into policy relevant insight.
My name is Dr. James Kinross and I work in the NHS. I have witnessed firsthand how the COVID-19 infodemic has caused irreparable patient harm. Redasa is a global infodemic response engine. Its objective is to save lives by transforming the process through which infodemic data is curated, peer-reviewed, analysed and turned into clinical evidence for frontline clinicians and policymakers. It is based on 3 technical innovations. Firstly, a proprietary web call pipeline for the continuous archiving of structured and unstructured data combined with intelligent search. Secondly, an open human-in-the-loop data annotation, quality assurance, and peer review platform called Curator. And finally, a living systematic review and veracity checking engine. The Infodemic engine is built on a scalable AWS AI stack, and our data is currently available through Amazon Open. MIT Solve will allow the Redasta initiative to become a global project based on the trinity of academic, governmental, and industrial collaboration. Thank you.
My name is Tobias Rinke de Wit, and I'm proud to present on behalf of Pharmaxis Connected Diagnostics, together with Trinity, building lasting epidemic preparedness in Africa. Africa is at the heart of non-preparedness for COVID, and the healthcare worker is central and facing all the problems, alone in a failing healthcare system. Our solution builds on three major revolutions in Africa: bankless banking, digital diagnostics, and mobile health insurance. It's called Connected Diagnostics. How does it work? We photograph rapid tests. We upload those into the cloud. We use this for a digital payment system, so the right drugs get at the right time for the right disease at the right patients. And we create a lot of data and dashboards that give transparency to this whole process. And therefore we create trust in the system. The healthcare worker is supported. Patients get quality. The healthcare worker feels safe. The policymakers get good dashboards, and the payers get transparency in where their money is spent. Let's be prepared. Let's walk together.
Identifying and responding to the next pandemic is important, but so is our ability to make a quick recovery, a social recovery and an economic recovery. Our last set of finalists have solutions that can make us more resilient to outbreaks and epidemics once they have occurred. This is important in all countries, and especially where healthcare resources are the most scarce, as we've learned during this pandemic. From empowering community health workers with data and digital tools, to building stronger supply chains, our recovery will be more effective with these solutions. Let's hear from them.
India is suffering the world's worst COVID-19 crisis. In rural areas, paper-based data collection limits our response to healthcare emergencies. We lack timely data and tools to better coordinate care. Our longitudinal mHealth platform facilitates screening, referral, and follow-up care. The digital platform utilizes biometrics, works offline, and provides decision support. Meanwhile, beneficiaries receive automated voice call reminders and awareness messages. Ultimately, health officials gather insights from our AI-driven GIS dashboards, and this leads to data-informed policies and deployment of services back to the rural communities. 60,000 health workers have used our solution to track the health of 14 million beneficiaries. Our model is to create technology solutions for public health free of cost to governments in India, and we serve as the technical support partner to the government of Rajasthan, and the government of India has also selected us to support vaccine tracking efforts as well. With the Trinity Challenge, we look forward to using the catalytic funding and network of champions to improve and scale our solutions.
Hi, I'm Sheila Kyoko from Living Goods. Meet Harriet. She's a community health worker. She provides primary health care to families from door to door. During the pandemic, her role was re-emphasized in ensuring families accessed care when and as they needed. Through the use of Living Goods, open source and mobile technology solution, dubbed Smart Health, 11,000 community health workers like her were able to reach 8.5 million families in Kenya and Uganda. They use the Decision Support app to provide case management, client-initiated health assessment, routine and COVID-19 immunization tracking, and severe case referrals to link facilities in and beyond the pandemic. With your help, our multidisciplinary team of experts shall strengthen governments at national scale across 4 countries, further improving health outcomes and pandemic preparedness over the next 3 years.
It is rarely only a question of supply. Precision matching supply to demand saves lives. The data infrastructure that supports pandemic response and healthcare delivery documents what's already passed. Systems that described yesterday are not as useful as systems that point to what will happen next. Strata is software that optimizes crucial supply chains by predicting what will happen next across the site, supply, people. Prediction helps organizations triage. Strata makes predictions by learning, largely from public data. Strata has been proven from Sierra Leone to California, Nigeria to Arkansas to Mozambique. Here's an example of the impact. Strata forecasts vaccine uptake with a margin of error of less than 1.5 doses for every 100 used across 4,000 health facilities. In Tanzania, help us give more governments the tools to make health systems predictive. Thank you.
1 out of 3 vaccines get spoiled in the supply chains. For COVID-19 alone, this will delay vaccination for nearly 3 billion people worldwide and prevent us from recovering soon. Our solution, Vaccine Ledger, can track every vial of vaccine from manufacturers to beneficiaries to prevent failures and ensure its quality and safety. Vaccine Ledger is quick to deploy and easy to use and can immediately show results in multiple lower income and middle income countries where we plan to deploy it.
Mark and Tsitsi, welcome again. Sally has introduced you already, and you probably don't need an introduction with this audience. You have been co-chairing the panel of 22 judges of the Trinity Challenge, and it's a real pleasure to take a few minutes now to get your impression and your take on this experience. Mark, let me start with you, if that's okay. You've done pretty much every possible job in global health, and you must have been incredibly busy at the beginning of the pandemic. What made you want to join the Trinity Challenge as co-chair? Why did you think it was important?
Good question. Well, starting with the personal, Dame Sally, I've learned that it can be hazardous to your health to say no to Sally. So that was the first reason. But you're going to miss a great opportunity. Anything she's involved with is always worth engaging in. And to be honest, it was also in part Tsitsi. I've admired her from afar for a while and the philanthropic work she does and the commitment to global health. You know, for us, it's a job, it's our vocation. She doesn't have to be doing any of this, and she does. And so it was a great opportunity to get to know her, and she certainly lived up to and exceeded all the extraordinary things I'd heard about her before. But also on substance, you know, this pandemic obviously is catastrophic, but you know, it's not over. I think we're at risk of having an escape variant to all existing vaccines by March to June of next year because of the immune pressure we're putting on the virus with partial vaccination. And for much of the world, no one's had access to anything, kind of like HIV was 20 years ago when I started on the global response there. And also future pandemics. I mean, because of climate change, urbanization, the way we interact with or poorly interact with animals on a husbandry basis. Sally and I have been working on antimicrobial resistance, which cross-sects to all of this. There's so much that needs to be done, and there are lots of commissions. I've been on a couple of them, which is our natural reaction in the international community when we have a problem, create a commission. And great work and recommendations have come out, but Sally did her usual, you know, right, well, let's crack on and do something. And that's what the Trinity Challenge has done, and done in a very unique way. You know, we're doing a good job, and some good things have come out, creative things, but this challenge is all about innovation. It's all about doing things differently, not the same way we've always done them, using new technology and involving communities, trying to get the best ideas from people at community level and from around the world, not just going to the usual partners, the usual players, the usual ideas. And so the Trinity Challenge has delivered. What you all just saw is a great example of what is out there and what is possible. We need more things like the Trinity Challenge to bring these kinds of ideas forward and to take risks. Our existing institutions, even big foundations, talk about risk. None of them actually take a lot of risk. And so this, I thought, was a unique, extraordinary opportunity. and it's paid off. So it's been great to be a part of it.
Thank you, Mark. That's fantastic to hear from you. And we definitely tried to go as fast as we could because of the urgency. But I want to pick up off your comments and the focus on the finalists and the technology and the innovation really, and turn to Tsitsi. Tsitsi, you bring your experience from business and from social impact and the Higher Life Foundation. You've worked with so many innovators over the years. I want to ask you, what were your overall impressions of this cohort of finalists that you've looked at?
Thank you, Hala. I must say, what an exceptional opportunity to be exposed to a cohort of scientists and global health experts who are embedded in communities and have very innovative ideas and methods and ways of trying to help communities and also the rest of the world just be able to identify pandemics, to be able to respond to pandemics. So I was really impressed. And I also just want to say, yes, we have 16 finalists, but the cohort is, it was difficult to even pick out who the winner is, because these are people who are dedicated. The presentations that they made, the proposals that they wrote, and the manner in which they answered questions when they were being interviewed by the various judges was just the authenticity of their commitment and also their passion to be able to play an important role in joining the global community that is preparing everybody for the next pandemic. I think was very impressive. So I have to say, I take my hat off. Their hard work was very evident, and also just the passion very apparent to all of us as we went about doing our work. And Mark, I will miss you. It was a lovely journey, I have to say. Yeah.
Thank you, Tsitsi. And I think it's incredibly important for us today to celebrate those winners, but also say how thankless the task you had was to actually boil it down to a few winning teams. And there is definitely information on our website and a desire from us to work with all 16 finalists and highly commended entries. So more than 30 projects overall, and a huge thank you to everyone who's applied, really. Tsitsi, one more question. I'm a bit greedy. I want to ask you your favorite moment or highlight during this experience of co-chairing.
Scientists are very quiet people. They have very little expressions on their faces. I have to say, the team led by Patrick, who managed the time and made sure that we were thorough in our discussions, but maintained order and decorum and also stuck to time. So he reminded me of my former headmistress, I have to say. So I want to assure all the finalists that the discussions were thorough, thanks to Patrick, and we kept our discussions to the time that we were given. So I appreciate that.
That's a super shout out to Patrick Diamond, who will have recognized himself, and the whole team at MIT Solve, who we partnered with to deliver the infrastructure for the challenge. So thank you to all of you. Thank you, Tsitsi. Mark, coming back to you, and given your experience supporting innovation in health and global health, going back to the AIDS epidemic and all these years, how do you think the audience who is joining us today can do to help these finalists amplify their impact, overcome challenges along the way? We know that way is long and arduous. How do you see collaborations and partnerships helping further accelerate these solutions?
Yeah, and that's the key, right? These are really innovative solutions with groups that aren't in the usual mix. And I think that's the obligation of everyone on this call, all the people listening, and everyone in our networks to follow what they're doing, follow the impact of what they're doing, and then get that out there and support them. No one organization can succeed on their own. And scale is key here. If some of these ideas that came forward scale, they could make a huge difference in the world. And so I think there's an obligation to continue. And I think things like the Trinity Challenge are absolutely essential. So I would also, to have everyone on this call, our meeting, gala, whatever we're calling it these days, join in and follow, support in whatever way possible. A new Trinity Challenge, more Trinity Challenges, things like the Trinity Challenge. We really have to get the type of innovation, the type of people and groups that responded engaged, and that means we have to support them. You can't just give them an award and let it go. We all have to get behind them and follow and support and push, especially with the ideas that work. And the ideas that don't work that well, work with them to figure out how. Why didn't they work? What can be done to improve them? And create the partnerships and help support the partnerships that will allow the ideas to move forward, because everything should fail a little bit. And to be honest, if everything succeeds, we didn't do our job, because we didn't take the risk. We didn't go after things that might fail, but it probably could succeed with a little change. So if we all stick with this and keep pushing and engage, the network that you all have created has huge opportunity to really change the paradigm and do things in a new and different way. So if everyone just engages, supports, and we need more Trinity Challenges, so I hope you all are up for it again. I also want to give a shout out to the group from MIT, especially Patrick. I mean, it's unbelievable what they did. I've been on so many of these things. They did a better job than anyone by far. They made our job very easy. So thanks everyone, especially Patrick, but also Mark and the whole gang.
Thank you. Thank you for both. And with no further ado, back to our chair and founder for the winners' announcements.
Thank you. So we've got inspiring competitors, we've got inspiring judges, and now you're going to be even more inspired. But I do want to say, please, everyone, look at all the finalists and the highly commended. There is so much wonderful stuff here that would benefit from support, that can change our lives. So here we are. Everyone needs recognition. Everyone needs help. That's why they're here today. And first up, I'm going to introduce you to the set of joint winners of the third prize. And they're going to each win an award of up to $480,000 from our pledged prize fund. And if I open the envelope, I'm not sure you can see the envelope. I'm in the wrong place, aren't I? There we are. I'm going to open the envelope. And the winners of the third prize are Kushi Health, data-driven response to COVID-19 in India, led by Rushit Nagar. Living Goods supported digitally enabled community health workers to strengthen health systems, led by Sheila Mutu Kioko in Kenya. MedSure Insights and Early Warning Systems, led by Dr. Asif Kwasim. Vaccine Ledger ensures quality and safety of vaccines, led by Sid Chakravarthi. Descendar, the disease surveillance with multimodal sensor network and data analytics, led by Shri Pagusioyon. You've seen all of these, so you know what they're about. But let me ask them some questions as they come onto the screen to join me. I'm not sure I'm in the right place, because what I want to do is ask all of you some questions. Congratulations on what you've done. And let me start by asking Rushit, Sheila, and Asif a question about your impact. You put this in because you want to make a big impact. You want to make people's lives better. How will the Trinity Challenge Award help you make that difference you want? Rushit, over to you.
Yeah, the Trinity Challenge will help us scale our impact in two key ways. First, by providing catalytic funding, of course, but I think the really big impact that we'll be able to make will be unlocked by the network of innovators and champions that we can learn from. So there's so many amazing colleagues that we are introduced to for the first time through this challenge, and we're really excited to share notes and learn from each other.
Great, so you heard it here, everyone. We need you to help these people. Sheila, how's Trinity Challenge going to help you make the impact you want?
First of all, we are honored to receive this award on behalf of the community health workers. Living Goods will focus on scaling the community health work over the next 3 years, expanding the reach to 22,000 community health workers in Uganda, Kenya, and Burkina Faso. To get there, we're looking forward to tapping into the partnerships from the private sector, building expertise on digital health, and strengthening the influence with governments for community health programming. Thank you.
There should be help for that too, Asif. Delivering your objectives, what's the Trinity Challenge Award going to do to help you?
Thanks, Sally. And first of all, delighted to have been awarded third prize in this. We can see that we have some technical challenges ahead, and there are clearly experts amongst the founders who can help with that. But one of the most powerful things that we can offer is that we've got a unique network of doctors and healthcare professionals. So working with partners like the WHO and the Clinton Initiative and the Gates Foundation to help execute on their programs will actually enrich the data that supplies into our early warning system. So we're hoping that working with both other winners and with founder members helps to enrich the data and add extra power and sensitivity to the early warning system.
I'm going to have to warn you now. All of you are going to have to help me in the fight against antimicrobial resistance, superbugs, the slow pandemic. But we'll come back to that. Now, let me ask the last two, Sid and Cherie, where do you most need help and how can our audience best help you? Sid.
Thank you. It's very exciting to win the third prize and congratulations to everyone else. So right now, a lot of lower income and middle income countries are still struggling with their vaccine delivery programs, and our solution can help them immediately. So if there is anyone in the audience who can connect us and get us, help us reach those countries, it would be of immense help.
Great, using blockchain too, so absolutely up to date. So thank you very much. And again, congratulations from all of us. Right, I'm now going to turn to the second group who are the finalists for the second prize. I'm somehow holding this in the wrong place, whatever I do. I've got the envelope here. I should have practiced more. I'm pleased to announce these two winners and I invite them to the metaphorical stage with me now as I read them out from the envelope. So, the Sentinel forecasting system for infectious disease risk, headed by Kate Jones, and blood counts, led by Carola Schomlieb. Congratulations, and I hope you're going to come on screen because, again, I want to ask you some questions. Everyone saw the videos, so they have an idea about what you're doing. But Kate, you're going to have some impact in West Africa. These are global applications, all of them. How's the Trinity Challenge Award going to help you achieve your objectives?
Oh, thanks, Sally. We're really delighted to win this prize from Trinity Challenge, and we're really excited about this. And congratulations to everyone else as well. So I really think that we've been working hard to work on the modelling and make it predictive in terms of forecasting these pandemics and infectious diseases in West Africa. But I think what we're really excited about is that the Trinity Challenge really makes this really possible, this translation, so into a real world deployment and situation in communities. So I think that's how I think the Trinity Challenge is really helping us really expand and scale this into these communities. And I think we would really need help from the members on how to create these interfaces like mobile phone apps, but also, you know, really usable tools for really busy people so they can use our tools in the setting that they're in. So that's how I think you guys can help us, and thanks very much.
Great. Carola, how about you? How can our members help you and the Trinity Challenge Award itself help you?
Yeah, so thank you, Sally. First of all, let me say that our whole blood counts team is extremely excited and grateful for receiving one of the Trinity Challenge Awards. So really, thank you so much. We cannot wait to start. engaging more with the founding members, further developing, testing, and implementing our blood count solution. So definitely where we can welcoming all the help that we can get is access to the right data from more locations, in particular from low middle income countries. We are aware that the Gates Foundation may invest in strengthening primary care in LMICs and bringing additional CBC testing capacity to countries in Africa. This will bring wider primary care benefits in these countries and also strengthen the blood counts approach. Moreover, challenge partners like Google and Microsoft could make really tremendous contributions to our solution, providing cloud services to many hospitals like Microsoft Research is doing, as well as Google with their Chrome extension apps, which calls out the results from local Coral TPU AI devices, which will really aid us in the scaling of our solution. Thank you very much.
Well, Microsoft and Google, you heard it here. I hope you'll help them as needed. And I think you answered the question, Carola, I was going to ask you. But Kate, how can the audience help you and the members help you most?
Yeah, I guess I kind of said it before that we've worked really hard on these algorithms, but actually the Trinity Challenge is going to help us pull all that data together, and we'll have these outputs. But it's getting those outputs to the people on the ground. And I think that's what we really need help with. So it's kind of like, how do we do that? What's the theory of change that these communities really need? So how do we figure out how to input that to make the most impact? So I think that's what I would really like.
Great, and I know you are working with the community in West Africa and with African centres, so that's fantastic. And I think what all of these winners are showing us is that academics have some fabulous ideas and can start to put flesh on them and make them real and deliver. But actually the business acumen of more than half of our partners will be important to help translate it into real action and making a difference. So I encourage everyone to help them. Thank you and congratulations, both of you, and to your teams too. And finally, I'm going to introduce everyone to the grand prize winner of the Trinity Challenge. You've all been placing bets on this and you'll all have views. So let's just see who comes out of this envelope. PODD, wonderful. Participatory One Health disease detection, led by the team leader and co-founder of Open Dream, Patipat Susumpao, who will receive 1.3 million from our pledged prize fund. Congratulations, Keng. I hope we're going to see you on the screen. We're all delighted for you. Our judges were terrifically impressed by your work. You've provided livestock owners in Thailand with a mobile app to help them report sick animals. Such a brilliant way to track disease outbreaks. It's real crowdsourcing of data in the best possible way. And of course, what I like is that you've incentivized the farmers to join in by making sure they get help with their sick or dead animals and to protect the other animals. They really want to join in. Thank you for the work you're doing and the fact that you're now going to spread it across Southeast Asia and into India. A couple of questions, though there'll be lots more from the audience and they will be able to find you in the breakout room. Hey, Keng, you've just won the grand award of the Trinity Challenge, our inaugural challenge. What's top of your mind now? What are you most looking forward to next, Keng?
Yeah, thank you very much, Dan Sally. I want to say thank you very much to everyone at PODD team, Chiang Mai University in Thailand, and Ending Pandemics in San Francisco. I still remember our meeting back in 2014 about how can we bring technology and digital tools to the village and the farmers to create participatory system for stopping the outbreak. Too bad we couldn't stop the COVID-19, but still we believe that PODD model, which in itself stands for Participatory One Health Disease Detection, can be example of how communities around the world can stop the next pandemic at the source.
Thank you, and everyone should note that important word, participatory. This is, like so many of the other ones, it's working with the community and building upwards. So to achieve your impact, how can the Trinity Challenge Award help you?
Yeah, we want to bring PODD to the world by creating a PODD toolkit as One Health as a service and make it available to everyone. Having the Trinity Challenge support will tremendously enable every community to implement their vision of PODD and reduce the risk of a future outbreak.
Wonderful. And what you heard was those other magic words, One Health, meaning how we are interrelated, the health of humans with animals, with the environment, our oceans, planetary health. Thank you for that. So how can those of our members and in the audience best help you? Where do you most need help going forwards, King?
Yeah, certainly to prevent the next pandemic, disease surveillance must be implemented in both directions, one from top down and one from bottom up. PODD focuses on bottom up approach by enabling anyone to be part of the disease surveillance. We need to connect with the partners who want to implement their version of PODD in their country. If any one of you in the audience believe in the power of citizens and participation and willing to have the local PODD implemented, please talk with us and work together.
Thank you, King. I really love this work. I'm thrilled by the approach. And as you will have gathered, everyone, it's going to help my other passion, antimicrobial resistance. So a big thank you again to you for all your efforts. And let me hand back to Steve Davis.
Well, thank you. And wow, congratulations to all the Trinity Challenge winners in this cohort. One of the best things about the work I do around the world is to work with brilliant innovators on really urgent issues. And this is such a great group. So we've heard from them now, and you'll have a chance to start your own conversation with each of them in a little bit. But they're progressing in a very, very fast-paced environment. And so we really want to do everything we can to make sure that they're successful. And so, as Mark was saying earlier, we need to sort of all gather around because it really does take a village to make these things work. And from my experience, the success and impact of social enterprises really requires strong partnerships, the right collaboration with both implementation partners on the ground and countries that are looking to scale up, as well as connections to governments and policymakers. And of course, there's technical and philanthropic expertise that many people in the audience may have. In the coming months, these winners will have an opportunity to build partnerships with the members of the Trinity Challenge and our broader network. And we're looking to all of our friends present at this event to help with that. And more broadly, for us at Trinity Challenge, we'll continue to support our winners as well as our finalists in making the necessary connections to succeed. We've all seen the power of collaboration that results from bringing for-profit, nonprofit, and social sector and academic partners together. And we'll also continue to encourage and support innovation in data and technology to support pandemic preparedness. So please give us your ideas, and we look forward to working with those of us at the Trinity Challenge to figure out what's next moving forward. As the world slowly recovers from this pandemic, we hope, attention may switch to other pressing issues that the world is facing. But we firmly believe that we must learn from our shortcomings this time, and we must use the upcoming time of rebuilding and reflection to support, to continue to support projects that will help us be better prepared for the next crisis. There is still so much work to be done to strengthen our data ecosystem for public health preparedness against emergencies. Now, these projects will help that, but they're only the beginning. With that, I want to thank you on behalf of the Trinity Challenge for all your attention. And I'd like to direct you to join the breakout groups of the winners that you are looking to connect with. Each winner will be hosting a breakout where they will present their project in more detail and open up for questions and ideas and networking. We strongly encourage you to join and share how you can contribute to the success of these projects. You'll be able to switch rooms and connect with multiple winners. So instructions should be coming up on the screen soon describing how to do this. So once again, my heartiest congratulations to all the winners. Thank you for your commitment and contributions to the world and making the world safer. And thank you to all of our audience and our community.
Thank you, all of you, for joining us for this celebration and congratulating the winners. I hope you will come into the breakout rooms with all of us and help these fantastic winners and finalists improve what they're doing, make it stretch, make it have an impact. So let's all celebrate together our finalists and our winners. Well done. Congratulations.